Yes, welcome, and please introduce yourself. And yes.
Yes, I'll do that. Hi to everybody. I don't speak Danish, so I don't know what you just said, but I understood my name, so I thought this is my time to speak now. I start with sharing my desk. Yes, he's just asking me if I want to get rid of your presentation. I hope that's fine. And then we start from here. Can everybody see the presentation now?
Yes, it's fine.
Perfect. Oh, that's great. So, hello everybody. My name is Charlotte Kröger, as she just said, and I'm really honored that we will spend the next 1.5 hours together, and that there was the decision to invite me for this talk. So I hope at the end of the talk you will have an idea about a new evaluation possibility for treatments of digital dermatitis. And for some of you that might not know everything about digital dermatitis or what it looks like, we will start with an introduction of the disease itself. I saw that we're not such a big group, so just in case you're happy with it, for me it's totally fine when you switch on your microphone when you have any questions in between or at the end, so we can actually talk to each other. That makes us a bit more familiar, and sometimes it's easier to get your questions through or what you want to discuss. So feel free just to hop in just whenever you have a question. So shortly as an introduction to me, I work together with my two colleagues. I just got the idea. You can actually add a pointer here. So now I'm all prepared. So here you see me and my two colleagues, Andrea Fiedler and Mrs. Scrim. I hope you can see the laser pointer. And you can see us working on a farm. So we do in our practice for Claw Health Associates, we work together with a single cow treatment of lame cows, or we do herd health appointments, or do trials when someone wants to see whether a wooden block is better than a rubber block, for example. This is one thing or one basic thing I do during the days. And there is some more things about me. Why we're here together today, I did my doctor's thesis about digital dermatitis and topical treatment. And as you see here, I'm employed at the University of Munich, and I teach anatomy there. And one big point is I traveled a lot. Actually, before Corona, I traveled a lot around the world, and I spent a lot of time on different big meetings on claw health. And so I collected everything that the people around the world found out to bring it to groups like you who haven't got the time to get to all those places. And for everyone who haven't had the chance to have a good look at digital dermatitis, what's the topic today, I want to introduce the disease to you at first. I mean, with every disease, it's the same thing. The best thing is it's not there at all. The M stage that Professor Gertrude Döpfer established with her doctor's thesis describes the different stages of this disease. And when we talk about the same thing, it makes it easier to compare the stages, for example, on the same farm, but on different time points, or on different farms when you want to compare what happens on one farm and what happens on the other farm. And what you can see in this picture, it's a normal skin, even above the bulbs and in the interdigital cleft here. So when we haven't got a sign of digital dermatitis, we say it's an M0 stage. The next stage, we say, okay, maybe there might be something of digital dermatitis, like a suspicion state, it's the M1. This is a really, really first stage. You can only see here in the interdigital cleft such little holes. And this is actually the beginning of digital dermatitis. This is not a stage that harms the cow. You would see this cow lame, but it's the first stage where it starts. And the M1 stage, the suspicion stage, it actually grows up, or it's definite. It's just under 2 centimeters. It can grow as big as that. also with erosive lesions. And it goes further, the acute state. I think most of you just know this one really, really well, because that's the painful lesion. This is a really typical one. You see that it's kind of at the height of the coronary band here on the hind feet. It's kind of in between or above the bulbs. And we have a really red erosive lesion that is most of the time actually kind of round, like you see here. And from this acute lesion, it's like kind of like they say it has to be, it's greater than 2 centimeters in diameter. We have got two possibilities where it can go to, like with every disease. You can either have the possibility that it gets to a healing stage, that we go the good way, or that we go to the chronic stage. So just let us think that something happens to that cow, that we get to the healing stage, we get to the M3 stage. And what you see here, this is kind of a crust over the lesion. Sometimes it's brown, sometimes it's black, and most of the time it's not really a hard crust, it's more a squeaky.
Kan du finde de små kugler?
I heard that someone had a question, but I don't speak Danish. This is why I don't know what you asked. So maybe someone can help with some English, then we get along with that.
I think it was a mistake. That was not unmuted.
Ah, okay.
That was what I understood.
Okay, no worries about that. So just in case you want to ask the questions, I'm really bad with Danish, just start with English. So we were just talking about the M3 stage, what we see here. And when you see this dark crust, it means that either your treatment that you put on the DD lesion, or the situation of the cow that, for example, the immune system gets in a better stage, is able to create this M3 healing stage. When we come from the M2 stage and we get not in the lucky situation of an M3 stage, we go further to the chronic lesion, the M4 stage. And what we see here is a hyperkeratotic and proliferation in the lesion, but it's most of the times, nearly all the time, these lesions, they are not painful. So it looks really gross, but most of the cows are not lame with this lesion. But from this chronic stage, there's the one point that in those little things here, this is not hair, this is actually like horn cells growing out of the lesions. And in those, we call it flaps, there are also treponemes in there that cause the lesion as well. So from this lesion, it's not painful, but it can actually appear that little tiny lesions like an M1, little red stages, appear again in this chronic lesions. And this is where we lead to the M.4, it said. That only says that we have, as we see here, chronic signs in that lesions, but we have also, like around here, also again, the open red lesions that are painful again in one lesion together. This is why we say we come from a chronic stage, the M4, but also the suspension states are in there as well. Again, everything that is under 2 centimeters, so we put it together. So when we look at the whole page, we see we come from the M0, we have nothing that we can call DD, it's a healthy hoof, or we have the suspension state M1, come to the acute stage M2, get to the healing stage M3, or to the chronic stage M4, from where it can develop an M4.1. I just tell that because when we come to the study into possibilities, what you can do on digital dermatitis, we have only the numbers, and to give you a good picture what it would look like when we talk about the M stages, I took the pictures in there as well. What is important when you look at those pictures, that DD is not a disease where a stage stays in there for a long time. It can also change. So you can have lesions that change in between M4, M4.1 and back, or you have lesions that change from M1 to M2. So it's kind of a dynamic process in one cow and also in the whole herd. But what I was really interested in were the M2 lesions. So I didn't know digital dermatitis until I started my studies to become a vet about 14 years ago. So on our dairy farm back home, we haven't got DD. And then I was part of a study where we looked at blocking systems for the hoofs, and everybody was kind of familiar with that disease and was comfortable with just treating it with different things. But when we came to that farm after about 4 weeks, I think we did the first recheck, we had to retreat the cows again. So I asked the question, what actually does topical treatment to the lesion on one hand, and how does the skin or the cells react actually to this topical treatment and the bacteria that are inside there? So I didn't find out that answer on the symposiums or lameness conferences, so I created the study myself at the university. So what I wanted to see is I took M2 lesions, as it's written here, and the statistician said that I will need at least 120 cows in the study, but at the end there have to be 100. And I separated those cows in 2 groups. I went before the study, I went for a long time on the farms and scored them for the M stages. And as all of you know, I think, there are cows that you see that they have an M2 lesion and you treat them once and they are fine for a long time. So you do not have to retreat them. And then on the other hand, there are cows on the farm and the farmer tells you, or you see it, that you have to retreat them every kind of 4 to 8 to 12 weeks. So those are cows that have to be retreated a lot of times. And we differentiate between those 2 cow types. It's type 2 cows, it's treated once and it's okay, and the type 3 cows. So you have to retreat them again. It's kind of a chronic regrowing of the M2 lesions. And I wanted to see, when I have different treatment opportunities, if there's a difference in the outcome when you look at the different cow types. When you ask yourself, what is about cow type 1? This is also one, these are the cows that never have to be treated for a DD because they haven't got that disease, which is a really great cow type, but I didn't put it into my study because it's not useful for having M2 lesions. I had 5 different treatment groups with 25 cows each, and the antibiotic and non-antibiotic topical treatment. And what I wanted to see is I took punch biopsies before I treated the cows on day 14, kind of in between in the in the situation where the wounds were healing, and on day 28 for where you would say that for a normal wound the healing should be completed. But what kind of topical treatment did I actually use? So the group number A here, you see here, is a polyurethane wound dressing. I don't know if you know that. It comes from it's a lot of times people know it from the human medicine. When you have blisters on their feet, a lot of people use it to put it on there. So it kind of pretends that it is proper skin on the wound, and it's a wound healing that acts with moisture. So we put that on, and it has to stay on there for 14 days, and then you can do a retreatment. So this, together with the treatment we see here in group number E, it stayed on kind of the whole study. The group number B, it's a normal typical CTC spray, chlortetracycline spray, that was sprayed on the day that we took the first biopsies, on day 1 and day 2, like it was written on the product, and we sprayed it twice. So we sprayed it, waited for 30 seconds, and sprayed it again. This is a big point, we did that, but I think a lot of farmers or a lot of people on farm don't do it for 3 days. So it's written on there that when you have really bad cases of DD, you should do that. In group number C, this is a copper and zinc chelate product which you can spray, and it was sprayed on the first day also twice, like we sprayed it, waited for 30 seconds and sprayed it on again, put it under a bandage, and then resprayed it on day 4 and on day 7. Here's number D. This is what is kind of really familiar, I think, for Danish hoof-trimmers, farmers, and vets. It's a salicylic acid. This product here is methyl salicylic acid. It's a veterinary product where they combine the methyl group to the salicylic acid to get a possibility to reduce the pain when you put this on a wound. And here is the group we glimpsed on earlier. It's the polyurethane wound dressing, as we said before, but underneath we added the CTC spray as well to have a look at if there is a improvement when you add those two things together. But what we have to say to group E is this is not a group with non-antibiotical treatment. So we have two groups with antibiotical treatment, and the C, the A, and the B, the groups with non-antibiotical treatment. And I put that picture there because every group got a bandage to cover the wounds from the biopsies and to make sure that the product actually stayed on the wound itself. And there was Mr. Klavitter from Berlin. He did a study about the necessity of bandages, and he found out that actually the healing, the outcome was much better from DD lesions when you put it under a bandage than leaving it without a bandage. This is just a short picture series of what I've done. So I cleaned the foot really well. Then I did local anesthesia because taking out punch biopsies out of those painful red erosive lesions might be, or it's a harm they do to the animal. So we worked with local anesthesia. This is a 6 diameter punch biopsy. And then we took out the biopsies, washed it, and put it into OTIP. This is an oral treponeme enrichment broth that kind of pretends for the treponemes that they are not in a dead body, little body part. So it tells them that they should come out into this broth to stay alive and not to insist themselves. And out of this broth, because the treponemes can migrate into the fluid, you can actually look at the treponemes there and see whether they are healthy and happy, or maybe they migrate not in there anymore after a good treatment. What I found out is that when you have here, you see the same cow, it's C32. And what you see when you do good treatment, so you come from an M2 stage, here you see an M3 stage, a healing stage, and at day 28, you can't really see where the lesion was at the beginning. So I had to kind of make a scheme for every lesion to see where I took the biopsies to make sure that I don't look at the skin that just heals from taking a biopsy. And then I had a look when I took everything to my lab. I had the possibility to look at the treponemes under the dark field microscope. And these are the treponemes as they are described. They're spiral and they are able to move themselves around. So they're not stationary somewhere at where you look at them. And then we also looked at them quite closely with electron microscopy, and this is just to give you an impression what they look like. And when you see their form, it makes sense that they are able to migrate into the tissue. But what they actually do is they migrate in between the cells, and we will have a look at that later on. When I found out that I wanted to, or from the beginning, I wanted to do histology, and this is what I want to show you as well to get an idea what the skin actually needs. I needed to find out first what normal healthy skin looks like to get a definition of where I want to get with my treatment. So here I took 2 punch biopsies, and just an overview what we want to see. We want to see kind of a close-up on top of the stratum corneum as a kind of first barrier against everything that comes from outside. We want to see a healthy stratum spinosum that when you say it in a really easy way, you want to have it like fingers getting together and getting in touch as a second barrier for everything that comes from outside, like bacteria or like chemicals. And down here we had the stratum, the basal membrane, the stratum, the basal stratum down here, and this is the third barrier. So we have kind of in a normal healthy skin, we have 3 barriers that protects the body from everything that comes from outside. And when we go further and look at, here is from the slaughterhouse, I took some feed and I took a punch biopsy there out of a DD lesion. What we see here is the topical layer that we wanted to have is gone, which is obvious when we look at an M2 lesion, because it's red and erosive. The kind of the first barrier, the stratum corneum, it's gone. But when we kind of focus on this area here on the histology slide, we see that also the second and the third barrier is gone. So everything that comes from outside can go right deep into the tissue. This is the first cow from our study. And when we started the treatment, before we took the biopsy, and it's exactly the same what we see. There's no stratum corneum on top that protects the cow from everything that comes from outside. And also the second and the third barrier, they are not so in line as they was before. So it looks like most of everything that should be arranged properly is kind of lost in communication. And when we go further on day 14, when we see from the development, the clinical development, we see that we kind of have really normal skin. And when we look deeper inside, we got the stratum corneum back, so our first barriers back. And this is something, when we compare it to day 28, there it just improved in thickness. We actually see, and this is a really important point that I think, as soon as you kind of close up the wound and you give the skin the possibility back to that it doesn't have to fight against what comes from outside, the barrier 2 and 3, everything that is underneath the stratum corneum starts to rearrange to get back to a normal skin structure. But even on day 28, when the skin here looks kind of healthy again, it's deep inside, there's still progress in getting back to a normal shape. When you just looked at this here, this is an old punch biopsy hole that we had there. So this was a really good outcome. But we had also other cows where we looked at the punch biopsy, treated them again. And when you compare those pictures of these cows, it actually looks like nothing had happened at all. And this was the first big difference, that we had lesions that reacted nicely to the treatment. And we had actually cows where nothing happened. Like this cow down here, when you compare day 1 and day 3, the same chronic lesion signs here are in those pictures and nothing has really changed there. So this was a bit frustrating. But what we wanted to do is, when we had the M2 lesion, and here on the right side had the histology slide, we wanted to not only see what did the skin do, we also wanted to know where do all those treponemes are, and are they gone when we have a healthy skin. So with an M2 lesion like here, and we look at the staining, this is a silver staining, a Warthin steri silver staining, and the treponemes are dark brown like chocolate or coffee. So everything here that we see on top, these are all treponemes that are on top, layered up here. When we compare it with this one, we see actually the stratum corneum, you can see that, but there's not such a load of treponemes there anymore, so most of them are actually gone. Sometimes I could find just a few of them still in there, but the number of treponemes was much less than from an M2 lesion. But when you actually zoom into those pictures, like here, we can see 2 different things. For the orientation, those black dots, that is just melanin from this was a brown Swiss cow, so this is why we have these dots in here. And all those brown points or strings. Like here, you can also see the spiral shape from before. These are the treponemes. And when you look at them, they're kind of in a circle around here. And these are the regions in between the cells where the treponemes migrate into the skin, into the tissue. And this is a big point, that they are not inside the cells, they're between there, because this makes it so hard for treatments to actually get in touch to the treponemes. But the really important thing, what everybody want to see and what I wanted to find out are the numbers. So what was actually the development of our M stages, of the M2 stage? When we look at that graph, we see here, down here, we see the weeks. So we have the first week every time where we took the first punch biopsy, where we started the treatment. So it's obvious when we started everything, it was 100% M2 lesions. And then after that, we took the other biopsies. So we see the development over time. It says that we have the whole herd. So we have just all the cows that we treated together. And on top, we see the different M stages. And what it says over the whole study, that we have a nice drop down from 100% here, M2 lesions, down to 23%. And the fourth dot here is always the prediction. So what will it be like in the future when the situation on farm goes on like it was before? We have kind of an even status of M4 lesions in here, and we have a rising number of M4.1 lesions together with, on the left side, a rising number of M1 lesions. So what does it tell us? We have the M2 lesions, which are open lesions, lesions where treponemes are kind of spotted around in the bone, the ones we wanted to get rid of at the beginning. This is a stage we don't want to have. And M1 stage, most of the time, is also a stage with really small erosive lesions, also a stage that we don't really want to achieve. It's a bit better than M2 because it's smaller in diameter, but not what we want to reach. The M4 stage, the chronic stage, is a stage where the cow is not in pain. So it's not the best thing. The best thing would be we get rid of DD, but we couldn't reach that. But the M4 stage, where the cow is not in pain, we get to the manageable state of disease. And this is the first point where we can start work. The M4.1 stages, it's also, we have the chronic stage and it opens up again. It's not a stage we want to have on farm because it shows that the DD, the active lesions are coming back. So really important was it here to look at the different groups if we have differences in the development. And I hope everybody it's big enough on the screen. I took out these three graphs from these three groups because they were, with their outcome, they were the best three groups.
Excuse me, Charlotte?
Yes?
This is Kurt speaking.
Hi, Kurt.
Charlotte, the previous graph, that was all the treatments together. So it was the average of all the 6 treatments.
Yeah, all of the 5. The 6 were just the bandage, to show that we bandaged all of them. So I just hop back. So this is why it says herd here, because it was in the program. We did it with the DD checker. This is a really nice tool. Just when you're on farm, you can just add in all the diagnosis you have. And so yes, here in this graph, it was everything together. So the antibiotic and the non-antibiotic groups together.
Okay, thank you.
You're welcome. And in these 3 graphs, these are the 3 graphs where we looked at the best outcomes from the 3, because the problem was what you're missing here is just the polyurethane wound dressing and the antibiotic spray. The antibiotic spray haven't had an effect at all, which was really breathtaking. But we had good results in these 3 groups. So the chelated copper and zinc minerals, the methyl salicylic acid, and the polyurethane wound dressing with chlortetracycline. And when we look at the developments, we see in all 3 groups a nice drop down in the M2 stage. So here we have actually a drop down to 0% of M2 stages. Here we stay kind of at just under 10%, and here something around 14%. The interesting part is what we just talked about is where does it go to? So here we have a solid base kind of on M4 stages, but all of them have a kind of a rising also in M4.1 lesions. Here it seems as if this would be the best one because we haven't got M4.1 lesions that much, but we have to look at the M1 lesions as well. So we have a big rise of M1 lesions. And when you add these yellow M1 lesions together with the M4.1 lesions, it's kind of the same as in the two groups up here. So when we say these three groups kind of have the same outcomes, and they are the best outcomes we got from these 5 groups, we have to say that this polyurethane wound dressing with the chlorotetracycline is an antibiotic treatment. And what it adds on, we need the bandage for such a long time on the wounds. What can be easy, but it can also be difficult on some farms. So we want to have a closer look at this group, the methylsalicylic acid and the chelated copper and zinc minerals. So now it looks different again. Group number C, this is the copper and zinc chelate, and the group D is the salicylic acid. And what I did now is I took together all the developments that are positive and the ones that are negative. So what is positive? Positive means everything that I want to reach on farm what would be a manageable state of disease for me. So the positive outcome would be M0, so nothing is there, an M3, so a healing stage, or an M4, and a chronic stage that is not painful anymore, and it's not open. This would be a positive outcome, and this is everything that is blue here. And the negative outcome, everything that is orange, would be an M1, so the first lesions of DD, the M2 where we started, so we don't want to have at the end the same that we have at the beginning, and the M4.1, the chronic lesions that are open again. These 3 types I don't want to have. So when we group that together, from every time the first one here are the type 2 cows, as you see here, type 2 and type 3. We talked about that at the beginning. The type 2 cows are the ones you treat at the beginning with the first M2 lesion they develop in their life, what you see, and they are fine afterwards. And the type 3 cows, the chronic cows, that are the ones that you have to retreat and retreat again and again. And you see here that there is a big difference. And the third one is always all the animals from the groups together. And there is, when you see the all together ones, you haven't got such a big difference. So you have a positive outcome here from 62% and here from 57%. But the main difference is that in this group, when you have an idea what is going on the farm, especially when you talk about the young heifers, where a lot of times the first DD lesions appear, when you know when it starts and you treat them immediately with the right treatment, in this point here, a copper and zinc chelate treatment, you have 82% positive outcome. But when you don't know about what is going on your farm, and for example, you would have a lot of chronic cows that have to be retreated for a lot of times, you would only reach a positive outcome of 30% in your herd. So it's really important in this part to know about the stages and the types on the farms that you go to, or in the conversation with the farmers, that it's really important to know and to look at the feed, what's going on there. On the other hand, when you don't know at all what's going on the farms, where is the development from M0 to the first M stages, or if there's a chronic cow or not, when you take the salicylic acid, all overall, it kind of stays the same. So there's no difference in cow types. So when you don't know nothing about the herd, you will get the kind of the basic outcome at all. What would be an outlook? This is one cow where I was really amazed with, actually. So I treated her. This was one of the copper and zinc chelated spray treatments on day 1. On day 14, you still see here the hole from the punch biopsy, and on day 30, you saw the other hole from the punch biopsy. And with this lesion, this is the typical, for me, also still an M4 lesion, because here the interdigital cleft, it's kind of swollen. You have a hyperkeratosis there, and you see some kind of old signs of digital dermatitis. But this lesion type doesn't harm the cow. She's not lame because of that, and she can walk around properly, and the farmer doesn't have to do a lot about her during the days. So she, like all the other cows that reach this stage of disease, they go into a preventive protocol. And that cow, I saw her all the times back for the routine hoof trimming. This is on day 180, and you still see that she has an M4, but still this M4 is not open. So the cow is kind of, she's not going to notice a lot about that. And on day 380, it still looked like that. So just with a preventive treatment here, they were sprayed twice a week with organic acids, or organic acid solution, better to say, and they got their feet cleaned every time they went into the milking robot. So the questions are, which is the most cost-effective treatment for the farm? We have to say, what is the long-term outcome? We just had a look at that. When you have a really proper good treatment, that the skin is closed and not irritated anymore, we have the possibility with a good intervention program that we can keep the skin like that, and which protocol is right for the individual farm. And this is something I want to kind of glimpse at in the next minute, or in the next minutes, better to say. We have to find out what is the best for the farm. We have to have the farmers, or we have to implement something that we do ourselves. We have to look at the feet. So we have to find out. Oh, there's a question, I think.
Yes.
Ask now?
Yes. If I may, it's Bjarne Elgaard from, okay. I have a question. Have you made any statistics about this? If there's any statistic difference between the treatments?
Yes, I did.
And what you have presented, was that within the 5% level of difference?
We can maybe look at the numbers later on. I did the statistics for that. The only thing we have to, or you have to say to the numbers, is that when you break down the groups into cow types, the groups get kind of small, because then there are only 10 to 11 cows left. But we get the statistical significance was not in all groups, but it was in the group with the that I showed you, with the salicylic acid and the copper and zinc chelate. It showed that there was a statistical significance to the treatment of the CTC spray. And what was with the CTC spray, we took that as a standard treatment, so as our normal treatment we used. And the problem was that not the problem, but the base was that we said that every non-antibiotic treatment had to be as good as the antibiotic treatment, because otherwise an antibiotic treatment wouldn't have the right kind of to be there in a treatment protocol. And we said that at least 9 animals out of 10 animals had to be effectively treated with the antibiotic spray. That was kind of the baseline for the statistics.
Okay, thank you.
You're welcome. When you have more questions, you are more than welcome to ask. So we have to restate, or we were interrupted at the point where I said it's really important that someone has to look at the feed and has to know what is actually going on the farm and on the feed. So what we see here is an open interdigital cleft. We can't look into the interdigital cleft when we are in this position or when we go like here into the milking parlor. But as soon as there is a big M2 lesion, or when the interdigital cleft is kind of swollen together, we get hyperkeratosis, it's a sign of DD and we can score this. Even when we just walk behind cows like this, we can see down here, kind of above my laser pointer, that we have an open interdigital cleft. And with this, it tells us that there's no chronic DD going on in this hind left foot. Another point is when the farmer cleans the cubicle system, he is able to see, or he should be able to see, lesions like this. On this picture, you can't really say, is it an M2 lesion or an M4 lesion? But there are 2 points. You can either look at the surface, and when it's kind of like a little bit shiny, it tells you that there is, it tells you that this is a moisturous lesion, and this is totally for an M2 and not for an M4. The other point is that you can softly kind of get in touch with this lesion with the foot. And an M4 lesion, the cow wouldn't really react. With an M2 lesion, she's going to lift up her foot quite quickly. So looking in the cubicle systems to the hind feet, this is something for farmers when they say, I haven't got time, I can't implement like a pen walk routine on my farm. It's possible every time to look at the feet when you go past the cows. And this is kind of, it should raise the awareness of the possibility, how often we actually pass the feet of the cows and we should look at them. Another thing is when you look at the feet, and in the milking parlor, you can't get that close to the feet and look at it closely, you would think that this here is a healthy skin and this is totally fine, which is right, it looks like it. But please be aware, when you always have to open up the interdigital cleft. And with this cow, you see here, you have these first erosive lesion in the interdigital cleft. So when you score the cows and you're really that close to the feet and you have the possibility to open the interdigital cleft and score the cows, you have to, for a diagnosis, you have to open the interdigital cleft, especially to find the cows that are M0, so they're not diseased at all. And then the next thing is, when you see or when you have a problem with DD on the farm, you want to find out where it comes from. You have to look at the right spots and you have to kind of be a little bit of an investigator. So with this farm, it looks kind of nice. So we have a lot of cows lying down, we have cows up here, and we have clean alleyways. But that farm had huge problems with DD. And when we look to the other side, what we do now, we see what the problem was. When the scraper went down the alley, this kind of looks nice and clean down here, but this we always call it kind of a poop tsunami. You see when the cows have to walk through here, you kind of dip the whole cloth, you see it up here with the manure. And this is a really bad situation or really good situation for treponins and maybe spreading DD, because not only that the treponins get to the skin, the bigger problem is that you irritate the skin and you provoke that you have wet feet, wet skin, and you get micro lesions in the skin where the treponins can invade in the skin. And a close up here, this is an alleyway where the scraper doesn't run that much, and the cows tell you a lot of things. Maybe when you're as a vet coming across the cows for an insemination, or you will see here that there's a lot of manure on the alleyway, maybe because the cows are fixed in the headlock waiting for you, and the farmer doesn't want to run the the scraper across the cows that are fixed, which would be good. The other thing is when you look at the feet, all the feet are really dirty over the coronary band. So as soon as the feet or the coronary band is dirty, it tells you that there is a lot of manure coming across the feet. It's normal that the claws or the claw horn kind of is a bit covered with manure, but normally up from the coronary band, it should be much cleaner. And the next thing is that, for example, this cow here and this cow here, she's not bearing her weight evenly on the hind claws. So the cow starts to tell you that there is a problem on the feet. When you find DD, as you see here, and this is also a treated DD, we have to do the decision whether we want to just spray and let her go, or if we want to have this bandage. Here, what we can see here, just in case you sprayed her in the trimming chute or in the milking parlor, and she's walking out, a lot of dairy cows have, maybe on a genetic way, but also sometimes because of a hoof trimming way, they have really low heel bulb in the back. So the DD lesions get actually in contact with the surface they are walking on. You can see that here. This cow walked into a cubicle system and made kind of an antibiotic spot in the cubicle system. And I think it was Kröger from the States who did a study about that, because he asked himself, he actually wanted to know if this spray here gets to the teats of a cow and make a residue in that milk from that cow. But he found out that a problem was also on that farm. He took like cameras on the cow, and he saw that the cow that lay down in the cubicle system after this one was in here got a really micro bit, but she got a residue or milk residue, like a little bit of antibiotics from these dots in the next cow. So this is a really important thing we have to be aware of, that we was just spraying feet with lesions that are kind of on the floor. We spread antibiotic in the barn on the one hand, and we reduce the percentage of product here on the lesions, because with each step we lose some of it. On the other hand, we have the bandage. We always work with synthetic cotton that the bandage won't get bad. And first, we cover here the interdigital cleft. Nothing that we put around afterwards can kind of cut into the interdigital cleft. We cover the coronary band. And then we work with those flex bandages. We go around the coronary band once, and then we kind of do a crossover through the interdigital cleft. And at the end, when we went around the coronary band again, we do the ending slope kind of through the interdigital cleft, and then we tuck it in around the coronary band, as you see here. Like this, with a lot of layers of this flex bandage, you get a bandage that is kind of waterproof. The more layers you put on here, the more waterproof it is, but the possibility is there that air still gets through the bandage. And when you tuck the ends in here, you have a round end of the bandage. So when the cow moves and a little bit of manure is on here, there's not a chance that the bandage cuts in. And this is important because, as all of you know, I'm sure that as soon as something like this happens, that the farmer or someone doesn't take the bandages off, it can also happen that it kind of cuts in. And this is the worst case that you can see when you use bandages to improve a DD situation. This here was the bull of a dairy herd, and this one wouldn't work for weeks when he got this, because he was so in pain by this bandage that cut in his foot. So I always say it's really important to do something about DD, and I really like to put on bandages, but I love to implement a strategy on the farm to get the bandages off again. So either I trust my farmer, he says he takes off the bandages, or I do a second appointment on the farm to take off the bandages when the farmer says he's not able to take them off again. I want to when we talk about DD, it's always about the lesions that we see kind of on the hind feet. We can also have them on the front feet. And when I go to, not to dairy farms, where we have farms where they have a lot of bulls that they kind of feed to put them to the slaughter at the end, we see also a lot of lesions at the front feet, or also at the front of the hind feet, like on top of the interdigital cleft. And there is something to it that it kind, I think it's about the last 8 or 10 years, I'm not too sure about that, there were a lot of non-healing toe lesions, they called it. So lesions on the hoof that they just didn't get to heal again. And I come across a lot of them. And what I want to say with this picture is that it doesn't matter on which farm, we need someone that looks at the cows and wants to find the lame cows and actually is able to find the lame cows. Because this was on a farm here where it was for a total different situation. And when I asked the farmer what he sees looking at those two animals, he said, are they enjoying the sunlight? And they like their cubicle system because they're standing in there and they're just relaxing and enjoy the day. He didn't even see that those 2 feet are kind of in pain, and they didn't want to use these feet. They were taking off the weight from these feet, and they don't even lie down because the cubicle systems were far too small for those ones. And when we talk about these lesions, I brought some pictures of them, non-healing toe lesions. This is kind of a toe necrosis in the tip of the toe, with an ulcer coming out of the toe. This is a axial horn fissure where also something is coming out, like here. We have an axial, the axial wall is going up here, and we have an ulcer that is coming out here, and the corium that we see doesn't look like the corium or what it should look normally. And when I took parts of those ulcers in the lab and looked at them, and in here there are lots of treponines. So again, when we have lesions somewhere and we have problems with DD on the farm, we get those lesions that won't get away anymore because the treponines are also here in the corium. And this is another picture of it. A lot of times when we have lesions here around the coronary band, there are also ulcers kind of popping out at the top of the coronary band. I saw that on a lot of robot herds. Sometimes when they implement the robot at first, I don't know why, sometimes there are little edges, and when they kick, they kind of get little diseased or little punctures here. And when the treponines get into the horn capsule, they do these ulcers. It's really, I just have to look. Yeah, when we want to do something about it, I always work with anesthesia. So I put something around the leg where the blood can't go away. And then I work here with a dorsal vein, if you see here, don't know if you can see that clearly. So I put anesthesia into the foot that the cow doesn't feel anything anymore, because everything that's together with the corium, also with these non-healing lesions, it's really, really painful. And we look again at this lesion here. Here's a bit of blood because we already did the local anesthesia. It's not enough to take this bit of corium off, because when you see, most of the times it starts somewhere here at the top when it comes out there, but the whole way down is affected with a lesion where treponines are on the corium. As you see down here, this is kind of coming out like a grape or like a strawberry, where the strawberry disease, this is what they call it in Germany because it looks a bit like it. So it's really important to open up the whole way where the treponines are gone into the horn capsule and where the ulcer separated the horn from the corium. And this is also a typical form of a hoof, where the cow, you see a swelling around the coronary band, and you see that the cow tried to put their weight way at the back at the heel. And when we turn it around and take the foot up, we see the farmer try to do something, but the cow walks on the heel back here and here, and something is coming out of the horn capsule there in front. So when we have a closer look on here, this is not that normal, but it's still corium. And here down here, here's again this grapey shape or strawberry shape. And a lot of people say we can't do anything about it. What I do is when I do surgery on feet of like this, we take away all of this horn that is kind of overgrown. It's a bit like with the chronic lesions, the cow tries to or it provokes a lot of horn or tissue grow. And what you see here, we need this connection of healthy horn and healthy corium again. And as soon as you have that in a really smooth coming together, not a sharp edge, that will heal again. Obviously we put this under a bandage, and when I came back, I changed the wrap around that hoof about always on the first day, because there's a lot of blood coming into the bandage. And what you see here, there's still a bit of what doesn't look normal of the corium, but here we have horn growing back around the tip of the toe. And the important thing is we put salicylic acid on here under bandage until the whole horn capsule is closed again. And when you do that until everything is closed again, the hoof will be fine again. When you stop doing the treatment, like when only this one is still open, the rest is closed, and you leave the cow out of the chute without a bandage, it will just come back just immediately. Important to that picture is also when we do surgery there, the cows get antibiotic and painkillers, or what do you call it? Steroids. They get to it because it's painful here, and sometimes not with this cow, but you're also close to the pedal bone, and when you have an infection coming to the pedal bone, it's important that they get antibiotics. And with this type of surgery, you can actually get these non-healing toe lesions back to heal. Yeah, and from there, I want to thank you for your attention. I wanted to just did this little outbreak to the non-healing toe lesions, with associated a lot of times with treponemes. And you're more than welcome to ask all the questions you still have, or what you want to discuss with me. And yes, and I hope you could see me and hear me, and it was easy to follow. Yeah, there are two questions. Maybe Mr. Dimitrov, you can just start, put on your microphone and ask your question.
Hello, Charlotte. My
Hi
name is
there.
Christoph. I want to ask you, can you share a little bit experience about digital dermatitis around dual claws? If you have that experience, can you share with us something?
Yes, we see. So the question was what I see, or what I experience with digital dermatitis around the dew claws. There are a few things I can say to that. I see it a lot of times, not on the whole herd. Sometimes some cows have it in a herd. Most of the times it starts underneath the dew claws and then it kind of goes around. Some farms have actually a problem more with it when they do foot bathing and the foot bath doesn't go up to the dew claws. Sometimes the cows haven't got DD at the normal spot, but on the dew claws. What we do all the time, or all of the times, we clean all the manure on the dew claws that we find and cut the dew claws back to their normal size, because a lot of times they kind of overgrow and go around like this. And as I don't know if I can show it, when you talk about the dew claws, their normal size is as wide as they are, as thick as they should be. So when you have dew claws that are kind of that long, you can cut them back to that length as wide as they are. And then we normally, as a hoof lesion as well, we cut out the dew claws so that there's no horn pressing into that DD lesion on the dew claws anymore. And then when it's just a small lesion, we try to spray it, and otherwise when it's not a or when it's a big DD lesions, we actually put a bandage around it. But it's really important that you won't put any pressure on the dew claws. So we build up a bandage around the hoof, and then we go like in 8 lines around the dew claws to fix the bandage and the product on the lesion around the dew claws.
Thank you. Thank you.
You're welcome. So what do you do? What do you normally do when you find that?
Normally, in my situation, these barns have a straw bedding. So, on my logic, the digital dermatites go up to the skin on dual claws. They try to use the zinc sulfate on the hoof pass around 7% concentration.
Yes.
But they are still struggling. I was trying to make a bandage with salicylic acid, but
Yes.
they still appear. So I believe maybe it's something in the nutrition. So we put organic zinc and organic minerals into the ration. So we will see what's going to happen on the next 6 months. So, but maybe it's from the condition into the barn, the straw. It's with a lot of moisture inside, and that's
This
why
is what,
they are.
yeah, what I wanted to ask, if it's a lot of moisture in the straw bedding, but it sounds a bit like they sink in and up to the dew claws, and there's kind of this cutting line of wet skin to the dry skin, maybe. And when you say they do foot bathing, the foot bathing covers up everything over and on top the interdigital cleft and a bit further up, but kind of spares out this bit around the dew claws.
Yeah, and the land, it's around 7 to 8 centimeters, so they don't cover also the dew claws.
Yes.
They need to go up to 15 centimeters just to cover the dew claws.
So it would be a possibility, yeah, to go further up, but I like your first approach to look at also the other conditions, because this is really important. It's not only about foot bathing, it's mainly about looking at everything. So when they get a really dry straw bedding, that will improve the skin condition. And when you look at the feeding as you did and say, okay, we improve the situation with, you said zinc chelate, is that right?
Organic zinc and organic minerals.
Yeah,
basically.
which is a really good point, because I will come to Mr. Kröger afterwards, because there's also a big study from Zimpro where they did something with the young heifers. They did that as well. So they implemented mineral to the heifer feeding, what you can take and improve the situation on farms immediately. And what you can take out from there, it's so important also for the dairy cows and the young heifers that they are in a good situation with the minerals, and that improves the skin condition as well. So yeah, I think you're on a good way. Yeah. So when you have any further questions and you don't know how to get along with it, you're more than welcome to contact me. To have a look at the foot baths or so, but it's interesting what's going on the farm there.
Thank you. I will keep contact.
There's another hand from Mr. Kröger. Or the Kröger?
Is it that me, Bjarne Elgaard?
Ah.
Yeah, okay. I just want to ask, in which cases should you not use salicylic acid for banding? For a bandage? I think perhaps we had a hoof trimmer who tried to treat a wound on his hand, and in 2 days it was because I think of this keratolytic effect was going down into the hand as it make the wound deeper.
Yes. So salicylic acid, it's really important when you look at what does it does. The salicylic acid, as you said, is keratolytic, so it kind of takes away basically the dead cells, but the cells it gets in contact with, and with the skin of the cows, they are affected with DD, they react in a good way to the salicylic acid. Really important is the skin of humans are really different, so it's much softer, and as you say, it can go really deep inside because it's kind of there's a lysis that the cells go away. So when we talk about the cows, where you shouldn't use it is with the, I wouldn't use it for a really fresh first lesion, because you have the possibility to take something else to clean it, to put the polyurethane wound dressing on it, or like the copper and zinc chelate. So just improve the wound situation, and never use salicylic acid with healthy corium. So as soon as you're on a farm and you get to an ulcer or to a white line disease, or especially a double sole, most of the double soles are kind of closed up, and they look like they must have been in contact to the outside, but there you see a lot of really you see tissue that shouldn't get any harm, because you're right at the corium, and when you put salicylic acid on there, you will just take away the corium and reach right to the bone. So it's important, healthy corium shouldn't get in contact with salicylic acid. And also no lesions that are somewhere in contact to, what do you call that? Like the skin around the eyes, the mouth, or like also with the other, you should be really, really careful. I would never suggest to use salicylic acid there as well, because there the skin is not that thick, and it goes right to the kind of producing cells inside.
Okay, thank you.
You're welcome. Are there any more questions or topics to discuss?
Charlotte, there's a question in the chat.
Oh.
Which kind of organic acid do you prefer?
This is a good question. It depends a bit on the farm and on the spraying system. What I prefer at the moment is actually first to clean all the feet, to make sure that the lesions are clean and the product actually can get onto the lesions. And I never use just organic acid itself. It's most of the time it's a combination from the organic acids in a licensed product, together with some skin friendly and skin improving things together, as we have in the copper and zinc chelate product. You also have spray fabrics to it. So I actually like the combination of skin protection and wound healing, and the reduction of bacteria together. Does that answer your question? Or are there any more in the chat?
No, there are no more
There's
questions.
just a hi from Kurt.
I have another question,
Yes.
Charlotte, then Kurt. If I should understand you right, do you think you can actually, you don't think you can treat an M4 lesion then to make it into a M0 again?
I think I didn't say it like this, but yes, I think my first step always is to get from the M2 lesion to this M4 lesion I showed you. A lot of studies, when you look at the pictures, what is scored, and they say it's an M0, it's actually something I called M4. I would say the last, do you know which pictures I talk about?
Yes, I think.
Yes. And we discussed it a lot, because I say this is a really good skin, but you can still see signs of DD. I would say I always I thought that these lesions would go away completely to get back to an M0, that I wouldn't find any signs anymore. I would say there are lesions when you start at the beginning, when the lesions are really small. You can go back to an M0, but most of the times it's not the first lesion you treat. I think we have to say that, because a lot of first lesions happen in the bines of the heifers, or are not detected at all because they are so small and going back to an M0. So as soon as I start to treat the lesion and I get an M4 where the cow is happy with, and the skin looks nearly normal, but when I have the hyperkeratosis around the interdigital cleft and just some new arrangements of skin above the interdigital cleft, I would still call it an M4, be happy with it. And I found that most of the times it's kind of like a scar and it won't go away anymore. And the third thing is, because I did the punch biopsies and looked at the amount of treponemes deep inside the skin, when I have, this is the questions of the definition of digital dermatitis, I would say when the skin looks like I showed you in this, from this cow from day 0 to day 360 or 380, and in this skin, you still find treponemes in that skin. So for me, this is DD. You have the treponemes in the skin and the irritation of the skin. It's not a normal skin. When you haven't got the possibility to look at the treponemes inside, maybe you could, other people would say, or say it's an M0. But as long as they are still sitting in there, I see changes in the skin, I would say, and it stays there over that long period of time, I would say I can't get it back to an M0. But if you animals will go back to an M0, maybe this is possible. But I think I'm not able to do that, for example, with a whole herd. I didn't find a way yet. As soon as I find a way, I'll let you know.
Thank you. But could you sometimes recommend actually a farmer to, if he has a lot of cows to choose from, that he could actually cull some of these cows?
I would. This is a good point. I would actually say you can't always tell everything in such a presentation. When you have the diagnosis of cows and you see the cows that you treated once and that she's fine again and she won't come back, and you have the ones that you see coming back again and again with kind of have the chronic stage showing, these are the ones where I would say it's like a mastitis. When a cow have in one lactation, she has got 3 to 4 mastitis cases, most of the farmers would just cull her and say, well, this is not economic, in an economic way, I can't keep her, and it's just work and money I put into that cow and she's not healthy. This is the same with this repeating M2 lesions or these chronic lesions. That's the one point. And when you have a lot of proliferation going on in these chronic lesions, it's said that those are the ones that actually have also a genetic background. So when I know that from the mother, that she has repeating chronic lesions with a lot of proliferation in there, it's more likely that the heifers coming from her have the same signs as well. So this is also, or would also be a reason to say, when I decide or I have to get rid of some cows, I would take that into decision as well, to say, okay, I take that cow away because I don't want to keep this problem also with their daughters in my herd. I don't know if you have also other findings about that, looking at the bulls.
No, but I totally agree. So I think I would, maybe you could pull bull, use a meat bull on the cow instead, so you don't get new offspring that ends in the herd.
Yeah, when you get her under control, but that's the point. First, you have to get her under control to use a meat bull on her to keep her. And still she's kind of making work on the farm. But when there are farmers that just want to keep a cow because they really like her and say, well, it doesn't bother me because she's nice to go into the trimming chute and I can treat her easily, and they want to keep her, it's okay. Then I want to just tell them, like you said, don't take their daughters into the milking herd. Just take out the replacement of the herd. That's right.
Thank you.
You're welcome. Are there any other questions or ideas to DD? There's nothing I can see so far.
No, I
So
don't
just-
think that.
Yeah, just in case anybody has a question at the end or in a week, or I think when you Google my name, you will find the email address. It's not on the presentations, on the last presentation slide here. I'm sure, yeah, there's the possibility to get in contact, and you're more than welcome to write down your questions, and I'm happy to answer them afterwards.
Yes. Thank you. Thank you very much.
You're welcome.
Ja. Yes. Og tak til alle, der har lyttet med. Og om 14 dage har vi det sidste webinar med Kröger om aftenen. Ja, det var det. Tak for i dag.
Selv tak.
Well, that was Danish. I didn't get what you said, but I think you said that we maybe say goodbye, everybody.
Yes, we say goodbye,
Okay.
and we have a new presentation in 2 weeks.
Okay. So what are you going to talk about in 2 weeks?
Gerhard Kramer. I don't know exactly what he talks about. Clause.
Well, you should really looking forward to that talk. He has a lot to say, and he knows a lot about hoof health.
Yeah,
and
But
all
he writes
different-
very short. When you email him, he answers very short. Very shortly. So
But when you have a presentation with him, he will tell even more.
yeah.
You can
Yeah.
be sure about that. Yes.
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 But thank you very much.
You're welcome. So when you just let me know when there are any questions coming up.
Yes. And I
Um,
got your email if there anyone writing me.
Yeah, you're more than welcome to forward that to anybody that has a question.
Okay. Yes.
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 So thanks a lot.
Thank you. Thank you. Have a
And,
nice day.
Then I just hop out of the presentation.
Yes.
Okay. And then have a nice day, and maybe see you soon somewhere.
You too, Charlotte.
Yeah, bye-bye.
Bye
Have a
bye.
good day. Bye-bye.
Yeah.